Hey guys, it's Ashley, and I'm going to talk about a patient that I saw today in clinical. This was a wellness recovery consult for alcohol use. The patient was a 36-year-old Caucasian male who appeared as stated age, who came in to the ER via EMS 2 days ago for acute alcohol intoxication. The patient states that he went on a bender and he drank a fifth of Fireball whiskey, half a bottle of Maker's Mark bourbon, several shots of tequila, and a better part of a 12-pack of beer. And he reported his last drink being 2 days ago. He states that he started drinking heavily after his brother passed away. And he stated that the situation surrounding his brother's death was complicated, unexpected, and it left many of his family, including himself, with a lot of questions. And it's left him with feelings of emotional distress. He stated that prior to the death of his brother, he only occasionally drank, and it was more of a social scene, and he denies any past history of alcohol abuse or illicit drug use. He did not have any pertinent medical or even psychiatric history. He has had no psychiatric admissions. He's never been treated for any psychiatric conditions or illnesses, and he's not ever received any psychotropic medications. So this was unique for me. Kind of got to see how it got started from the ground up. And he said that he really has struggled over the last year with his relationships, with his family, with his wife, with his kids. Strangely enough, no altercations with coworkers or no impairment with work. He did report that he's been feeling a lot differently since the death of his brother, and he no longer enjoys things that he used to, like reading and exercising and spending time with his family. He's become much more withdrawn and reclusive over the year. He did state that his wife and his mother was requesting that he ask about getting some help for his alcohol use. And he reports feeling depressed more days than not, and rated it 8 out of 10 on the depression scale today, and 1 out of 10 on anxiety. He had no suicidal or homicidal ideations. No hallucinations were elicited. And he was awake, alert, and oriented to person, place, time, and location. So really the only history with substance use has just been the alcohol, and it was occasionally, maybe a couple of times a year, to over this past year, it's been almost daily, if not nightly. He said he uses it to help fall asleep, and that his recent bender again was around the anniversary of his brother's birthday, which was just 2 days ago. He denies any history of amnesic episodes, denies histories of tremors, no history of withdrawal seizures, and no history of DTs. He does report cravings today and withdrawal symptoms today that consisted of nausea, diarrhea, mild tremors, restless legs, sweating, and some insomnia. No hallucinations, no tobacco or illicit drug use, no amphetamine, cannabis, or benzo use. Never had inpatient or outpatient treatment, never attended any NA or AAs. And as far as with him, again, no pertinent medical history, but his family has a pretty extensive history of addictions. And so his mother, maternal grandfather, brother, and sister were all nicotine users. With depression, there's his maternal grandfather had alcoholism. Both his siblings had polysubstance use disorder for heroin, cocaine, and opiates. Actually, his brother died of an overdose. His sister also had PTSD, anxiety, and borderline personality disorder. So pretty unremarkable childhood. As far as mental status exam, he was thin, he was unkempt with dirty clothes and unshaven facial hair. He was dressed appropriate for the season in t-shirt, jeans, cowboy boots, and a jacket. His mood was nervous but pleasant. He was reluctant to talk at first, but cooperative as the interview continued. He expressed anger and guilt when discussing his brother. He was able to maintain adequate eye contact, and rapport was easy to establish. His affect was congruent, and the patient became tearful and reported periods of emotional numbness lasting hours to days with mood changes, sadness, and anhedonia. No abnormal motor tics were noted. There were no tics or noteworthy mannerisms. His speech was clear. The rate was regular and with soft volume, flat tone with fluent English. He denied any hallucinations. There were no delusions, obsessions, or phobias elicited. His thought form was linear. His emotional distress was elicited when discussing his brother's death. The patient denied any suicidal ideations, no homicidal ideations. He was awake, alert, and oriented to person, place, time, and location. The patient was aware of current events. His recent and remote memory was intact. Cognitive function was intact, and he was able to adequately complete serial sevens. He spelled the word world backwards correctly, and he had appropriate abstract thinking. Insight was intact as his knowledge about his addictions were there. His judgment was intact as he was able to safely participate in his plan of care, and his impulse control was poor as he has difficulty not engaging in the addictive behaviors. So what happened with this patient? He was diagnosed with alcohol use disorder severe and dependent. He was also diagnosed with alcohol withdrawal and major depressive disorder unspecified. So they gave it unspecified because they needed more time to kind of tease out all the different symptoms to determine between the specifiers such as anxious, stress, mixed features, melancholic features, so forth. He definitely met the criteria for major depressive disorder based off of his reported symptoms and rating that most of the time he feels depressed. So his treatment plan included, he was started on an SSRI Prozac for his depressive symptoms, 20 milligrams once a day in the morning, and the medication will need to be titrated accordingly over the next few weeks, 2 to 3 weeks, based on his continuing symptoms, with the max dose being 80 milligrams a day. He was also initiated on a CWAP protocol for symptom-triggered management for the alcohol withdrawal. The dangers of medication noncompliance were discussed with the patient, and he understood. Psychoeducation referral was offered for CBT therapy, and he agreed to go to an inpatient rehab program specialized in alcohol addiction after he was medically cleared and discharged from the facility. Once completing that program, he will then continue to follow up with the Wellness Recovery Outpatient Clinic for the management of his alcohol use disorder and depression or anything else that might come up along the way. So, hope you enjoyed it. Thanks.